All right, welcome back to ABA exam review and the continuation of our BCBA practice questions series, where we are continuing with some BCBA practice questions that we're going to break down and go through together. If you're new to the channel, welcome. If you're returning, welcome back. Please subscribe for all of our updates. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you do pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. You want to improve reading fluency and comprehension. Instead of teaching every word individually, you design lessons where the client learns root words, prefixes, and suffixes, which can then be recombined into novel words. Why is this approach potentially effective for achieving your goal? All right, interesting question to start. First, the question is asking about achieving our goal. And what would our goal be? We want to improve reading fluency and comprehension. Now, the strategy is we're not teaching individual words, we're teaching root words, prefixes, and suffixes in order to do what? In order to evoke these novel words. In other words, we're teaching these base skills, which can then be used by the client to evoke novel, untaught behavior. So, given all that information, why would this approach be effective for our goal? A, you will be able to teach the skill more quickly and the client will acquire competency at a quicker pace. Well, we can't say that for sure. And you want to be careful on the exam and especially in real life by giving guarantees such as, well, this is going to happen quicker. We can achieve this faster. No matter how we teach, we can't guarantee we're going to go to a quicker pace because everything is individualized. B, it increases stimulus control by reinforcing only directly taught word combinations, ensuring errors do not generalize. Read this carefully. Stimulus control for only directly taught word combinations. Well, that's not what we're trying to achieve here, right? We're teaching these base skills to get untaught novel words. So B does not fit. C, it ensures stimulus equivalence by directly training all possible relations among words, pictures, and sounds, so learners won't need to derive new relations. Again, we're not trying to teach all possible relations, we're trying to evoke novel words. So B and C are both wordy and they sound good, but both are directly opposed to what we're trying to do. D, generative performance will become a focus for the client. Yes, generative performance. We are teaching a base skill, and from those skills, other skills emerge novelly. In this case, recombine into novel words. So the approach is effective potentially because generative performance will become a focus for the client. Grant is deciding between implementing a token economy or a group contingency to reduce off-task behavior, or both. Grant runs both interventions across different groups of students and looks at both effectiveness and efficiency. Why would a component analysis be useful here? What is a component analysis going to do for us? Well, with the component analysis, if we have a treatment package of A and B, we can look at each individual component by removing or adding in components to see, okay, do we really need every component? Which one is necessary? Is there one that's having a larger effect? It's going to let us analyze each component of the treatment package instead of the package as a whole. And so, why would a component analysis be useful for Grant if he's looking at a token economy or group contingency or both? A, it would help identify which treatment would receive more preference from the client. That's not really the goal of the component analysis. We're not looking for a preference of intervention. We're looking for effectiveness and if it's even necessary. B, it would help identify which part of the treatment package was sufficient and or necessary. Yes, a good reason to use a component analysis is you can identify what component of an intervention is sufficient, meaning it's there and good enough to get our result, or necessary. Do we have to have it to get our result? C would help identify the dosage required for the treatment package. That, of course, dosage, of course, is a parametric analysis, not a component analysis. And so since A and C are out, it can't be D. That leaves us with B. It's going to help identify the part of the treatment package that was sufficient and or necessary. A student frequently calls out during class without raising their hand. The teacher says this is disruptive. We should punish him by taking recess away every time he calls out. The behavior analyst, however, writes a plan that reinforces appropriate hand raising with tokens and attention while ignoring callouts. After 2 weeks, callouts decrease and hand raising increases. Why did the behavior analyst choose reinforcement? Okay, a convoluted question, but a simple answer. Okay, why did the behavior analyst choose reinforcement? Let's go back to basics. With ABA, we're always trying to start with reinforcement, right? We want to increase skills we want to see, and we're a reinforcement based science, more or less. So the student is calling out during class without raising their hand. The teacher wants to punish immediately. The analyst, however, has both a reinforcement approach with hand raising and an extinction approach. So why is that behavior analyst going with their approach over the teachers? A, reinforcement strengthens desired behavior while punishment only suppresses problem behavior. Sure, right? After 2 weeks, callouts decrease and hand raising increases. So if we had just gone with punishment and only decreased callouts, that's great, but we would have missed the part about the increase in desired behavior. B, punishment is never ethical to use in ABA practice. Of course, that's not true. We have to consider the ethics of punishment, but we use punishment frequently. C, reinforcement is always faster than punishment in reducing behavior. Be careful, reinforcement never reduces behavior. So C is just wrong. D, punishment eliminates the function of the problem behavior completely. That doesn't really even mean anything, right? With punishment, we're not reducing the function of a behavior, we're just reducing that behavior altogether. So ultimately, pretty straightforward question if we go back to basics. When we are teaching something or getting rid of a behavior, especially getting rid of a behavior, we always want to try to add something in its place. And so reinforcement is going to strengthen desired behaviors, and punishment is only suppressing problem behavior. A student calls out to the teacher during lessons without being called upon. You reinforce hand raising during lessons, but do not reinforce calling out. The teacher asks you if this is a DRI procedure out of curiosity. How should you respond? Okay, so how should you respond? You get a question from the teacher. Is this a DRI procedure? What do we know about a DRI procedure? We know we're teaching a replacement behavior. We know the replacement is incompatible with the original behavior. So we have to ask ourselves, what is the original behavior? The original behavior is calling out without being called upon. You're reinforcing hand raising. Can the student raise their hand and still call out without being called upon? Sure. Hand raising has nothing to do with the student calling out. Even if the teacher doesn't call on the student with the hand raised, the student can still call out. So how should you respond? A, DRI because raising hands prevents calling out. It doesn't. The student can raise their hand and not be called upon and still call out. B, DRO because reinforcement occurs when no calling out happens. It's not a DRO, right? We're not reinforcing for not calling out. We're reinforcing the new behavior of hand raising. C, DRA because hand raising serves the same function but is not physically incompatible. Yes, hand raising is going to get the student the ability to answer it or call out, but it is not physically incompatible with calling out without being called upon. So it's not even the greatest target, but it isn't a DRI. And then D, non-contingent reinforcement, because reinforcement is time-based. It's not. It's based on doing appropriate action. So the answer here is C, DRA, because hand raising serves the same function, but is not physically incompatible. All right, thanks so much for watching. Check out behavioranalyststudy.com for all of our study materials. When you do pass your exam, let us know so we can include you in the Sunday shout-out. As always, work hard, study hard, spread the word, and we'll see you soon.